Hello friends, I am Dr. Kinshuk Chatterjee. I am a head and neck oncosurgeon and I am presently working with Manipal Hospitals Broadway. Today I am here to tell you about and break certain myths associated with oral cancer. So oral cancer refers to cancerous malignant growth which are there inside the oral cavity. It can be on your cheeks, it can be on the tongue, it can be on the gums, it can be on your palate as well, and on the inner side of the lips. Now, who are those who get oral cancers? The commonest etiology or the reason for having an oral cancer is tobacco and alcohol. Now, tobacco comes in two forms. One is a smoking tobacco and the other is a smokeless tobacco, and both are equally responsible for causing oral cancer. In our part of the world, that is in India and in other developing countries as well, chewing tobacco is a menace. People take tobacco in the form of gutkha, khaini, pan, zarda, and also areca nut, which is supari. Over and above that, there is a habit of smoking as well, smoking mainly in the form of cigarettes, bidi, and cigars. People who take alcohol along with taking tobacco are at more increased risk than individuals who take either of this alone. Besides this, there are certain other causes like an ill-fitting artificial denture, some sharp, jagged tooth which constantly irritates your tongue or your cheek, which can also be responsible for causing an oral cancer on a long run. There are certain vitamins and minerals, the deficiency of which can cause oral cancer, but the chances are very minimal with mineral deficiency causing oral cancer alone. Now, what are the symptoms which, if the patient or an individual has, will warrant him that he should visit a doctor first? Number one is a sore or a non-healing ulcer in the tongue or in the cheeks or on the gums, which are present for more than 2 to 3 weeks, which are not disappearing with application of some over-the-counter ointments or gels. Besides this, there can be foul smell coming from the mouth, there can be difficulty in swallowing, there can be a slight slurring of speech, there can be pain, but pain is not usually at the initial stage. When the tumor has grown bigger and it has involved certain nerves in that area, the pain appears, and this pain can be referred to the ear of that side in which the tumor is there. The patient can also have a swelling in the neck, which indicates that the tumor has spread to the regional lymph nodes. So if any of this is present, one shouldn't wait, should definitely visit a doctor, preferably a head and neck oncologist or someone who is trained in treating oral cancers. A myth is there that taking a biopsy spreads the cancer. I like to tell you all that this is absolutely a false, wrong statement. Any form of cancer requires biopsy at its earliest stage to diagnose and to initiate the treatment. If someone undergoes a biopsy procedure and then neglects taking the final definitive treatment, the disease can spread. But it doesn't usually spread when the treatment is taken timely. So a biopsy is necessary. There are certain investigations, imaging, like a MRI or a CT scan, depending on case-to-case basis. We advise either a CT or a MRI before we start on the final treatment. The treatment for oral cancers is surgery, surgery, and surgery. If the tumor is seen to involve certain critical structures which cannot be removed, then only the alternative form of treatment, which is radiation or chemotherapy, comes into play. But usually, as long as the tumor is operable and as long as the individual who is undergoing the procedure is fit enough to undergo the procedure, the treatment is surgery. In today's era, the surgery is all the more not a threatening thing because we have very good plastic surgery backup in our team. So plastic surgery means taking some tissues from the patient's body, other parts, and using it to fill in the defect which is being created at surgery to remove the tumor. This is called microvascular free flap reconstruction. After surgery, if there are certain adverse features and if the tumor is staged stage 3 or stage 4, additionally, adjuvant treatment in the form of radiation or chemotherapy is warranted. And most importantly, a patient after completing his or her treatment needs to stay under follow-up for the entire of his or her lifetime. For the initial 2 years, the follow-up schedule is every 3 monthly. For the next 3 years, that is from year 2 to year 5, the patient needs to visit the doctor twice a year. And if everything is normal and under control, after 5 years, only one annual checkup is necessary. So break the myths. Do not adhere to rumors. If you have any of the signs that I have mentioned, feel free to contact us. Avoid tobacco and lead a healthy life. Thank you.